Good evening, Pahrump. Dr. Creig Christensen with the Independent Wellness Center here. Excited to be here tonight. Looking forward to your calls and your questions. It's middle of August. School has started, and I think the weather's even starting to cool off. We're excited about the things that are going on in the office. We're excited about the patients that we're seeing, and looking forward tonight to your questions. So let's light those phones up, numbers on the screen, and let's get this show rolling. I'm waiting for Dr. Reiner to get here. He's running just a little bit late, but he assured me that he will be here tonight. And again, we're excited about visiting with you. Ray, we got Ray on the phone. How you doing tonight, Ray?
Yeah, I'm doing fine. I'm trying to mute the TV so we don't get this feedback.
There you go.
Hey, I asked a question last week, and I know both you and Dr. Reiner heard it, and today was confirmed. I was at the in-custodies where the prisoners are brought up in front of the judge, usually on a first appearance, and one guy couldn't show up. They said they were going to do a video with the jail because he had MRSA, and they said he's in isolation, and they were really concerned. And I'm wondering, is this something that we really, is it contagious or what? And the second thing is, as far as the jail, is there a doctor that goes there regular to look at these people? They're just on call when something happens? Would you know about that?
Yeah, I've got. I know that the jail here locally, they transport and take the inmates over to the ER at the hospital. Regarding your question about MRSA, that's a question that Dr. Reiner's going to have a lot more knowledge on than I do, because I frankly don't treat infections.
Well, tell him when he gets in.
Well, I'm going to tell him, but I can't tell you everything that I've read about MRSA and the patients that I have had that have encountered it. It's a really contagious, bad staph infection, and again, you get this mainly in hospitals. It's a staph-resistant penicillin organism, and once you get it, it is almost impossible to kill it, i.e. staph-resistant, penicillin-resistant infection. And if they're picking this MRSA up in the jail, I personally think they got a real problem.
Yeah, it could be someone that just wandered in, the last couple of days and had it, but it just seemed to me it was a concern. They said isolation. So, well, anyway, I'll call in later. I want to open these lines up because I've been accused of hogging lines on.
Nobody can accuse you of that, Ray. We love your questions.
People call me afterwards. They want to give us a break. Let us call in.
Well, why don't you have those people call us, Ray?
Okay, shall do.
Thanks.
I'll call later. Thank you.
Yeah, MRSA is a really, really, really bad organism to pick up. And again, you see it a lot in the hospitals. And it's just really hard to get rid of once you get it. I know you're on IV antibiotics, and you're on them for a prolonged period of time once you picked up the infection. And if it is occurring in the jailhouse and the guys are picking this infection up, that could be a really bad thing, in my opinion. Again, it's not my expertise. That's Dr. Reiner's expertise. I'm primarily a musculoskeletal guy. I treat sprains and strains. I treat arthritis. I treat fibromyalgia. I treat I basically treat healthy people. That's why I enjoy doing what I do so much. And Dr. Reiner will be here in a minute, and we'll get him going on the MRSA question. In our office, in the wellness center, we do everything as holistically as possible to help people. with the musculoskeletal problems that they have, we do a lot of traction, intersegmental traction and decompression traction to help people with bad low backs, people with arm pain and leg pain, people with headaches, people, motor vehicle accidents where there's been an acceleration, deceleration injury in the spine. You know, football season has started with the kids and with the smaller kids in Pop Warner, so we'll be seeing a lot of ankles and knees and shoulders. But I don't treat infection in my office, and I'm kind of glad that I don't. That's the tough place to go. Let's keep those calls coming, guys. Let's give me a call and have a question for me. Our number 751-7041. Is there a caller on the line? Yeah, hello. We didn't catch your name. What is it?
It's Colleen.
Colleen.
And I was just wondering, Doctor, could you please give an explanation of what pain management is?
Pain management?
It keeps being mentioned to me, but I have no clue what they're trying to do. Pain management.
Well, you know, pain management is something that is pretty new. It's a specialty where these guys try to fine-tune the meds that are being prescribed, Colleen, because of the overuse of the opiates and even across-the-counter drugs that people are using. The pain management tries to find the combination of medications and drugs to address your chronic pain. It's usually used for herniated discs in the low back. It's usually used for, you know, ruptured discs in the neck. Post-surgically, they use pain management, and it's just exactly what it says. It's for the management of pain. What are the questions that you have, Colleen, that you're concerned with?
Well, I just have a problem with my knee a lot of times.
Okay. Has it been diagnosed with an MRI? Have we looked at it to see what's going on?
Yes. As a matter of fact, I've also been getting cortisone shots every 3 months.
Well,
and the first one didn't seem to work, but the second one worked.
Well, you know, cortisone is an anti-inflammatory. It's the strongest anti-inflammatory that the medical profession can use. Unfortunately, you're limited on how many times you can use it a year. I think 3 injections a year is about the limit on most injuries with the cortisone. And it is an anti-inflammatory. It reduces the swelling in the areas that it's used, and it's highly effective. Occasionally, though, it doesn't work. And it is a painful procedure when they start injecting that into the joints.
Well, actually, maybe it isn't cortisone that they're putting in my knee, but the first one, I didn't feel anything, and it didn't seem to work until like weeks later. I suddenly started to get some relief. But the second one, yes, wherever he placed that needle that time, I did feel a sensation. It wasn't all that painful. But the next couple days, it took me a little bit of recovery time. But ever since then, I haven't even had a real problem with my knee that much at all.
Well, thank God for that. You know, the knee is a pretty highly specialized joint, and it takes a lot of wear and tear. You know, we live in a day and age now where, you know, if they cannot eliminate the pain and if the knee is completely wore out, you know, they can go in there and replace that joint. I can't even begin to tell you how many joint rehabs, knee rehabs that we do a year. And our, you know, as our population ages, you're going to see more and more joint replacements. But up until that point, the cortisone, the pain meds, the physical therapy, the things that you do to try to keep a person in the game, is what we're able to do for you people. How young are you, Colleen?
You had to ask that. I am not young.
So I would imagine you probably have a lot of degenerative arthritis in that knee. Are you bone on bone in the knee?
You know, I don't know that. I do know they did request a second MRI. I have had an MRI done, and they came up with torn meniscus.
Okay.
But I just never had the second one done due to, you know, money restraints.
Yeah, I understand that. Colleen, we got to take a break right now. Stay on the line because I want to talk to you about the torn meniscus and get some more information about you. Could you?
Okay, sure.
Thanks.
Thank you.
Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.